progressive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio. Here's Melanie Cole.
If you're someone who has to have surgery for a particular condition, you want the techniques to give you the best outcome. My guest today is Dr. Sang Lee. He's one of the nation's leading experts in laparoscopic colorectal surgery and is a member of the medical staff at Palmdale Regional Medical Center, as well as a member of the medical staff at Keck Medicine of USC. Welcome to the show, Dr. Lee. Tell us some of the most exciting advances in your field.
Yeah, one of the things that we have been working on, and over the last 10 years, we've been trying to treat patients with the colorectal diseases using less invasive techniques such as laparoscopic surgery, and nowadays we're trying to combine the laparoscopy and endoscopy to even avoid removing a significant part of the colon to treat very large colon polyps and other benign conditions of the colon and rectal.
So tell us about that combination surgery and how does that work for the patient?
So, for example, if a patient presents with a large colon polyp that a gastroenterologist decide that it's too large or too difficult to remove using colonoscopy, 50% of the population in this country will require an open colon resection, meaning they make a large incision in the abdomen and they remove a significant part of the colon. If you're lucky, 50% of the population that live in a area close to a big institution, academic institution, and then you may be able to undergo laparoscopic colon resection. But still, even in that situation, morbidity associated with the procedure is significant. What combined endolaparoscopic surgery, for short, it's called CELS. What this technique does is we combine the advantage of laparoscopy and endoscopy. So we simultaneously perform colonoscopy using carbon dioxide gas that doesn't inflate the colon as much compared to conventional air colonoscopy. And then we also use the laparoscopic tools so that we can manipulate the colon from outside. So what that allows us to do is to manipulate the polyp in the colon from outside of the colon so that we can then remove these benign polyps using colonoscopy. And then an advantage that we have over gastroenterologists is that we can, if you create a defect in the colon, then we can immediately recognize it and repair it. So the bottom line is, by doing this procedure using this technique, we are able to remove these difficult and large polyps. And difference in outcome is that patients who have laparoscopic surgery, they stay in the hospital for about 3 to 5 days. In comparison with this technique, patients often go home on the same day. After laparoscopic colon resection, patients return to work in about 3 to 4 weeks, but with this technique, patients can go back to work in 3 days. So it's much less morbid procedure with a very, very, very good outcome.
You mentioned benign colon polyps. Can this be used for cancerous polyps as well?
We have used it for select patients where patients who are elderly and have a lot of other medical morbidities who are not very good candidates for laparoscopic or even open colon surgery. And we have used this technique in select cases with very good outcome as well.
So tell us what else you're doing as innovative techniques that you really want patients to know about.
Yeah, I mean, we not only treat a very straightforward cases, but also very complicated cases. So patients who've been to other institutions and they were told that there's really not a lot that they can do. We use multidisciplinary approaches. So we work together as a team from different specialties to tackle these problems. So oftentimes we're able to offer, for example, patients who present with rectal cancers that they were told they needed to have a permanent bag by using multimodality therapies. We're able to offer a good outcome with potential for cure while avoiding permanent colostomy, permanent ileostomy, for example. So I think having a very specialized experts in in different fields coming together and working together, I think, to allow us to provide a much better outcome and much less morbid, much less risk.
As a laparoscopic colon and rectal surgeon, what do you see going on in the world of laparoscopic and minimally invasive surgery that patients should know about?
Yeah, we just had a meeting in San Diego, Digestive Diseases Week, where all the gastroenterologists and surgeons come together for an annual meeting. And what I've seen, and there's a lot of push toward, is to avoid performing a bowel resection. So traditionally, as surgeons, we offer essentially removing a piece of intestine and then joining it back together, and that's been our treatment for many, many, many years. Now, technique and technology has advanced to a point where we can do a lot of the procedures without going into the abdomen. We can do, we can actually go through the colon from inside. There are tools that allow us to take care of disease process. It's called the endoluminal surgery. So you can probably see you can see more and more of these type of procedures being offered for the patients. So although technology is not quite there yet, we will be able to offer a much less invasive treatment for all the benign as well as the cancer conditions using these latest techniques.
And what would you like patients to know about prevention of issues for their colon and for rectal issues that you tell patients when you're done working with them?
Obviously, the chances for cure for colon cancer is greatest when patients present with early stages. Colon cancer is one of those diseases where if you start to exhibit symptoms, oftentimes it's too late. For colon cancer, also, we have a tool that can prevent patients from developing colon cancer, which is colonoscopy. So when somebody without any family history, without any symptoms, turn 50, they should get a colonoscopy, and usually it takes about 10 years for benign polyps to turn into colon cancer. So it's very, very important that everyone gets a screening for colon cancer by having a colonoscopy performed, and I think that's probably the greatest, probably the best way to prevent from patients from ever having colon cancer.
In just the last few minutes, Dr. Lee, what should people with questions about some of these innovative techniques we've been discussing be thinking about when seeking care?
Yes, obviously, it really depends on the surgeon's experience and training. Although there are a lot of new innovative procedures out there, if the surgeon is not experienced in performing these type of procedures, it doesn't necessarily translate into a good outcome. So I think the experience and training really matters.
And why should they come to Palmdale Regional Medical Center for their care? Tell us about your team.
We have 3 internationally and nationally recognized leaders in the field of colorectal surgery, and especially in the area of laparoscopic and minimally invasive colorectal surgery. We're proud to bring the same expertise to the Palmdale area. Currently, a lot of the patients are traveling outside of the area to come to us and come to other institutions, but we're offering the same expertise and same techniques so that we can take care of the patients in their setting where patients don't have to travel too far and that they're very close to their families after having a major surgery.
Thank you so much. It's absolutely fascinating information, Dr. Lee, and thank you for being with us today. You're listening to Palmdale Regional Radio with Palmdale Regional Medical Center. For more information, please visit palmdaleregional.com. That's palmdaleregional.com. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. This is Melanie Cole. Thanks so much for listening.